This is the story of a 62-year-old male patient. His main symptom was a gradual onset of difficulty in swallowing, both solids and liquids. Whenever he was taking food, there was difficulty in swallowing with mild nasal regurgitation, at times with choking, and difficulty in swallowing solids as well. So he usually had to have some water also to aid swallowing, but that too he was finding it difficult. Gradual onset. Along with that, he was feeling excessively sleepy during the daytime, with episodes of sudden onset sleep, especially while driving. Sometimes, when he became extremely sleepy, he would collapse onto the floor. During sleep, there were very violent, jerky movements which the wife noted, along with abnormal hand movements like thrashing, picking, or making some abnormal sounds during sleep. 1 year ago, he had an episode of multiple joint pain and swelling, which promptly resolved with a short course of steroids. An MRI was done, brain which was normal. The patient also had memory impairment in the form of difficulty in learning new information. He was 62 years. A polysomnography and an MSLT test was done. There was no sleep onset REM ruling out narcolepsy, but MSLT showed excessive daytime somnolence and reduced daytime sleep onset latency with an average of 9 minutes. I repeat, no sleep onset REM was noted. An event evaluation revealed significant dysphagia with pooling of saliva, indicating a high risk of aspiration to semi-solids and liquids, and hence the Ryle's tube was inverted for initiation of tube feeding. After ENT evaluation and a FEE study, the feeling was it was a neuromuscular cause of dysphagia. One blood test was done which revealed the diagnosis. Can you make any guess on that? Please do share in the comments. And please do share this with your friends who might be interested in such interesting medical case stories. Thank you. I'll see you on the next episode. I'll reveal the diagnosis as well as a detailed description of the. In complex or challenging cases, the easiest and the most effective way to arrive at a diagnosis is through what is called a pattern recognition. When we encounter a clinical scenario that resembles a previously seen pattern, where a specific combination of symptoms align with a known condition, it allows us to quickly narrow down possibilities and direct our investigations accordingly. In this particular case, we are looking at a 60-year-old gentleman, 60 plus, presenting with progressive and significant sleep abnormalities, which is very prominent, including REM sleep disorders. Number 2 is what is prominent is a swallowing difficulty with nasal regurgitation. Number 3 is gradual memory decline, and number 4 is gait abnormalities. This particular combination of symptoms strongly suggests a recently recognized autoimmune encephalitis known as anti-Iglon 5 disease, immunoglobulin-like cell adhesion molecule 5 disease. This disorder is caused by autoantibodies against the Iglon 5 protein in the brain. The key to diagnosis is testing for the anti-Iglon 5 antibodies, both in the serum and the CSF in patients with suspected disease. Once identified, the treatment involves a stepwise approach. The first line therapy involves steroids, followed by IVIG and plasmapheresis depending upon the response. And the second line, of course, is immunomodulation with rituximab and other immunomodulating drugs. This condition, why I am presenting, is because it is frequently misdiagnosed as progressive supranuclear palsy or motor neuron disease due to the overlapping clinical features. However, if you can recognize the unique pattern of symptoms, it allows for timely diagnosis and appropriate intervention. So, the takeaway from this case is whenever you encounter a patient with progressive sleep disturbances, excessive daytime sleepiness, and REM sleep disorders, they have swallowing abnormalities, memory decline, and gait abnormalities, think of anti-Iglon 5 disease. Order serum CSF and CSF anti-Iglon 5 antibody testing and confirm the diagnosis. Hope this case helps in refining your clinical pattern recognition. Looking forward to discussing another interesting case with you next time. Thank you. The test which was ordered was the serum test for Iglon 5 antibody, and it came strongly positive, confirming the diagnosis of Iglon 5 autoimmune encephalitis.